Hi, so now is our third phase, which is going to be the pharyngeal phase. So I'm again using an example patient. So our patient for this phase is going to be Lisa, and she's 70. She's also recovering from a mild stroke. So our observation right now is that during eating times when she's eating, softer foods such as mashed potatoes, the food's reaching the back of her mouth, so it's completing phase two, but then she's coughing or gagging it back up. So the food is basically going down the wrong way, and that's going into the airway. So this is making her swallowing feel a lot more effortful, a lot more tiring, and she again sometimes needs those multiple swallows to help clear her throat. So what's kind of going on here? What's going wrong? So she's having difficulty in this phase 3 when the bolus is supposed to be moved safely from the mouth throughout the throat into our esophagus. So this swallow and airway protection are impaired. So the structures involved in this process is going to be the pharynx, the larynx, the epiglottis, and the soft palate or velum. So starting off with our pharynx, this is just kind of when those are those throat muscles that's helping our food move downward. So we're also going to be using the pharyngeal walls, and the muscles included in this are going to be the superior, middle, inferior, and pharyngeal constrictors. And this just pushes that food down towards the esophagus. So this is going to use our cranial nerve 10, which is our vagus nerve. And now it's going to use our cranial nerve 11 a little bit, which is our accessory nerve. So next, we're going to look at the larynx, which is also known as the voice box. And this is going to include the suprahyoid muscles, which more specifically include the mylohyoid, the digastric, and the stylohyoid muscles. And this is just getting our larynx, moving our larynx up for the airway protection. Because again, we don't want that food to go down that airway, which is causing the coughing and gagging. So this is going to use cranial nerve 5, which is our trigeminal nerve. And then again, this is also going to use our cranial nerve 7, which is our facial nerve. Next, during this phase, we're going to look at the vocal folds, which is our intrinsic laryngeal muscles. And this is what closes the airway during swallow, again, to protect our airway from food going down that way. So this is going to include cranial nerve 10, which is our vagus nerve. And then we're going to look at the soft palate, which again is our levator veli palatini, which the function of this is just to close off the nasal passage to prevent the food from coming out of our noses. And then this is cranial nerve 10. So yeah, again, we're just focusing on moving the food downward, elevating our larynx to protect our airway. Then we're looking at our epiglottis, which folds over our airway to prevent aspirating. And then the soft velum, which closes off our nasal passage. So some functional consequences of this is going to be when the food is entering the airway, that's when we get the choking and the aspirating. Again, that swallow is becoming a lot slower, a lot more effortful, making her much more tired. And since there is the possibility of aspirating so often, we're really looking out for the risk of pneumonia. So basically, in conclusion, that's the pharyngeal phase. And again, this is just when the bolus is moving much faster and quicker through the throat while the airway is closed to protect the lungs. So there's a lot going on during this phase, and just really making sure that the soft palate is working to prevent the food from going up our nose. So again, when these muscles and nerves don't work properly during this phase, food and liquid can enter the airway, which can cause choking, aspirating, coughing, and honestly just becomes really tiring for her. And this is what makes it so hard and so effortful. Thank you.